Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Now, I have a special guest here who's been here before, Scott Fitzpatrick, who is a master acupuncturist and among other things. Did you bring a guitar here, Scott, today?
You notice this guitar just in case we need it. If we don't make it in medicine, we'll make it in music, I guess. Is that how this goes? Maybe?
I think we both could. At least
I
you
hope
could.
so.
I could play rhythm.
There we go. That'll work.
That's actually a hollow guitar.
Yeah, it's pretty fabulous.
It's a practice guitar.
Well, man,
You'll have to play that
I'll have to work it
afterwards.
later.
We may do it along with some Grateful Dead stuff.
Sounds good to me.
Okay.
I wore my appropriate socks too, by the way.
I know. Anyway, we're doing this follow-up from the first podcast you saw Scott do on fascia.
Yes, sir.
That connective tissue that kind of holds everything together that nobody ever thinks about,
Right.
and how important it is for the structure of your body. You know, for the patients that we both see a lot of, people hurt.
Yes,
I mean,
sir.
they're stiff, they hurt, and you bring relief to so many people through acupuncture. It's unbelievable.
We do our best.
And then you have Robin, who does physical therapy.
Yep.
I mean, you really cover all the bases.
Yeah. We've got a great team.
You got a really good team. You
exceptional
got
team.
one member of your team that's very camera shy.
Yes, she's a little camera shy, but I promise you, she's my adult supervisor. So anything I say wrong will be corrected.
Okay, all right,
just like that. So
And
it's good.
Robin's always here handy in
She's-
case one of us screws up.
That's right. She's here.
But in any event, we're going to talk about fascia. If you want to listen to the original podcast on fascia, we'll put a link to it. But let's talk about some practical stuff that you can do to release that fascia that's tightening your body up so much.
Yeah, that sounds wonderful. You know, last time we just defined fascia, which it's really the most broad, vague definition is the glue that holds everything together. And I think one thing we mentioned was if you can imagine a piece of gauze, looking at a piece of gauze and just draping it over your arm, that's like fascia being draped over something, be it a muscle, a nerve, whatever. So what we're going to talk about today is kind of two parts: stretching fascia versus stretching muscle, and exercising fascia versus exercising muscle, because there's a difference. And we don't usually think about that.
Yeah, I never think about that.
And of course, like I said, we said this before, but heck, when we went to school 100 years ago, we didn't even talk about fascia.
No.
You know, fascia control, you know, the meridians and channels that we use in acupuncture are thought to be inside the fascia. But still, yeah, you know, when you and I went to school, that was about it.
You know, we saw it in our cadavers, and certainly when we were doing surgery. You know, I used to scrub in with my dad all the time. And I
yeah.
remember separating the fascia with your fingers. You really, you know, you don't want to cut through the fascia. You can kind of separate it with your hemostat and your fingers. But there was definitely something that you could look at in there and identify as fascial planes.
It's got to run your finger right up underneath it, and it's just an incredible thing. And you know, thank goodness to people like your dad who helped further this research into fascia and learning, oh gosh, well, let's don't make these huge incisions, let's make smaller incisions, because smaller incisions typically heal better because of the fascia. So, you know, I guess the big thing, let's start with stretching fascia versus stretching muscle. And again, there are 1,000 different theories out there, but one of the most recent theories is going to be when you stretch a muscle fiber, finding a space to get it into that's where the muscle is not loaded, and you hold it for greater than 90 seconds. So we call it our 2-minute stretches. So everything is a two sides, because we want balance. We want 2 stretches, because if you give people too many stretches, then they won't do them, you know, and for 2 minutes. And that's, as a general rule, a really good way to see the muscle start to release and stretch. You know, whereas before, you know, when we were growing up and playing sports, they had us doing exercises where you bend over and touch your toes. That's a stretch. That's not a stretch. That's a muscle warmer upper.
Yeah.
You know, they have you do jumping jacks, stretching your shoulders, stretching your arms. Those aren't stretches. Those are muscle warmer uppers. There's a big difference. When you actually stretch a muscle, it needs to be in an unloaded position for greater than 90 seconds. So a 2-minute stretch. We're going to talk about that in a second. Now, the weird thing is, because muscles are linear and we're stretching them in one plane, 2 minutes is adequate to get those things to turn loose. When we start talking about the fascia, again, go back to that fabric laying over your arm. it's multi-plane. I think they call it. There's some kind of technical world about the way the fascia goes in multiple directions. Optidirectional.
Good term.
Yeah, and the interesting thing about that is because it is optidirectional, you can't just stretch it one way, and it takes more than 2 minutes for it to release. And I think we've seen before, they've talked about fascia release and stretches need to be 30 minutes. So a hamstring stretch. So if I'm going to teach someone how to do a proper hamstring stretch at work, which we like to do, find a stool, nice good posture, tighten your tummy. We're going to get to that part in a second. Nice and long, and you're going to start getting a little bit of length here in your hamstring. Gentle, gentle, gentle. When you start to feel that stretch, you just hold it, you breathe, you smile. Don't hurt yourself and don't bounce. That's for the muscle. 2 minutes. Now, for the fascia, they want you to do this for, like I said, up to 30 minutes, which is crazy because it takes that long for that fascia to turn loose. So, very, very interesting how the difference between a muscle stretch and a fascia stretch is profoundly different. Oh, look, we've got some.
We've got some dogs.
We got some guests here that'll teach us some. But you know what? If you watch dogs
These
stretch,
dogs are loose.
But you watch them in the mornings. What's the first thing they do?
They do a
downward dog.
Yeah,
that's exactly. Well, that's the most important thing. You know, we can learn so much from these dogs, and if you'll notice when they do it, they don't bounce.
No,
they just lean into it. They breathe. A lot of times they probably yawn, and then they feel much better. And that's what we're trying to do with stretching. So stretching of fascia and stretching muscles is a little bit different. Same thing goes for strength building. Let's go really simple stuff. We talked about this before. Bicep curls. I'm afraid they're going to chew my ball again. Bicep curls. Simple bicep curls to strengthen the muscle. We want to isolate the bicep. It's really linear. Now, that doesn't work for the fascia, again, because it's optidirectional. So the funny thing is, the newest research that they're talking about exercising for fascia, you're going to love this, is getting back to our childhood, going to a playground, swinging from monkey bars.
just playing
multi-directional things. Think about this. Think about someone who has, and we've seen a million times, that are really, really stiff and don't move really well. They look really old. And it's like the less you move, the more that fascia gets matted down, the older you look, and really probably the older you get, the faster you get.
Is that why when you just move as an older adult like me, you feel better?
You feel better, yep. But I think the funny thing about you is you do this instinctively. So you don't just go to the gym and do bicep curls and bench presses because you want to have these big, strong muscles. You're out playing pickleball or walking dogs. You're doing things that make you do all of these, I love this word now. It's going to be my new go-to word, optidirectional stuff.
That's a new one for me. I like it.
But it's really vital when you start talking about moving fascia in different planes and exercising. So stretching and strengthening, two vital parts of fascia. And now we're going to talk. So we got kind of a foundation when you do some of these things. I brought a little. It's called a massage peanut ball here. We're going to go straight to lumbar spine pain.
I've got one of these in my gym. I never know what to do with it.
This is one of the craziest things I don't even recall where we found this. Do you, Rob? Don't ask her. She's not talking. So I don't know where we found this thing, but it's really, really pretty cool. The lumbar spine. So I don't talk all over the place because we can talk every joint and specific exercises. Maybe if somebody has specific questions or a specific joint or something they're having problems with, maybe they can email you and we can touch base on that later. Let's talk very specifically the lumbar spine pain, lower back pain.
Because that's where everybody has pain.
Everybody's got pain. Yep, you've got it. I've got it. She's got
Bad.
it. She's got it. He'll have it if he's, one of these days.
These
he'll
dogs
be old
don't
enough.
have it.
The dogs don't seem to have much of it because they don't do what we do, which is defy, two of the laws of physics. One being gravity. They're walking on four legs where we're standing.
That's right.
And that is one of the most challenging things we have as we age. As we age, and we start to lose height, and we start to lose sensation, and our strides get a little bit or gaits get a little bit altered, typically you'll see people start to lean forward. And then what are they doing? The hamstrings or their knees are sore and they're achy. So they've got, fascia problems here. It's not just always arthritis. And their hamstrings aren't getting long. Their backs are curved and gravity's pulling them down. So they're just tight and stiff all over.
It's so interesting you mentioned that, because just today I saw a patient, and he was in his 60s, but he was a black belt in karate, had done it all his life. We started talking about, he still teaches it, but he also does some Tai Chi.
Okay.
But he told me that he just watch an old person walk. They're humped over. Then they'll get a cane and walk on a cane, which further humps them over. Then they'll get a walker and more forward movement. He says, get a stick. He goes, get a stick that reaches your shoulder, and you'll stay in an upright position. I'd never heard that until today.
Yes.
And you're really collaborating that, because people do not need these canes that are short and walkers that makes the problem worse. Then they fall.
Yep. I can't believe that's funny, because Tai Chi is one of the things we're going to talk about in a minute. But the cane thing, think about this cane. Go back to the walker. Go back to the cane. When we're leaning forward, the heaviest thing on our body is our heads. Yeah. That gravity's pulling our heads down. What's holding us back? I've said it a million times, but if you think about the spine being curved, why is the spine curved? It's to help carry a load, and specifically so that if you get hit on top of the head, your spine doesn't explode. Kind of important.
It's a shock absorber.
It's a shock, exactly. It's a shock absorber. But the other beautiful thing about that is when you're standing up with the cane, or the let's just call it a walking stick. Yeah. Now what you've got is
it what hikers use?
It's what hikers use. I would even say not even hikers. I would say
shepherds.
A shepherd. Yeah, a sage. Somebody that's walking through a field that wants to be more upright, because it keeps their balance back. It's the way that your friend put it is really perfectly kind of relatable to our discussion today, because it gets your center of gravity back. Yeah. Now, I'm not telling you to fall backwards. What I'm telling you is that when I look at you from the side, I want to see the top of your head go over your heel. The hardest bone in your body, calcaneus, your heel. Hardest bone in your body. And you think about how that load goes right up through really large bones, tibia, femur, huge bones. But then the spinal column, huge thick bones, they're like that for a reason. If they're stacked, we've got a nice kind of load, then there's no strain on the fascia. None. Their muscles aren't even really holding you up much. But now as soon as you pitch forward, what starts lighting up? Lower back.
Your lower back.
Because it's going to keep falling
every
down.
time.
Yeah, every time. And then what you do, you'll see people's knees start to bend. They get a little short. And it's just this whole cascade. And then they come to us. And they're like, or they'll go to the orthopedic surgeon, who may put them a new knee in because they have an arthritic knee. That may fix the arthritis, but that doesn't fix the fascial pain. Big difference, They may have to go get an orthopedic surgeon or neurosurgeon and have a laminectomy, microdiscectomy. That can help with the neuropathic pain, but structurally, you're going to still have that fascia stuff. So, failed back pain, we were just talking about before we came on air. We see it every single day. The guy walking, like you said, walking on a cane, then a walker, and then they fall down. And it's tough. What do we do for a lower back pain when somebody comes in and they say, well, I'm trying to avoid surgery, or I've had surgery and it really didn't fix my pain. So what do we do? What do you do? You've got a lot of tricks up your sleeve,
Yeah, a lot of times I'll send them up to Ernie.
Yeah, sure. For some physical therapy.
But I never really thought about why your spine is curved at different parts, but that makes perfect sense. It's to keep you in an upright position and act as a shock absorber.
Yeah, it's perfect.
Because your head is about a 30-pound weight.
It is.
That
some of us a little more.
Yeah, you've got more brain than I do.
I don't think it's brain.
You're probably
depends on who you ask, but but it's really incredible, because if your spine were completely a straight line, it would explode. If you fell on your rear end, you slipped on ice and fell and loaded that thing,
your neck would break.
Yeah,
well.
It really would. I mean, you'd be
just like dominoes. The whole thing would fall.
Yeah, so that's really the fascinating thing. So failed back surgery. First thing is make sure they're medically okay. Make sure there's nothing else goofy going on, which we all do. But let's say they're medically healthy. They've just got this failed back surgery. We evaluate them. They're really tight around that scar line, or they've not had a scar line. And we say, you know what, your fascia is locked up. And I think I mentioned this last time, but the way I describe it to people was having a flat tire on the front of your car. You got a flat tire in front of your car, you keep driving, wears out everything. You know, you can put bigger tires on it. You know, you can put another engine in your car, but you better fix that tire. That tire's the fascia. So loosening up that fascia. So the stretching thing helps. Stretching hamstrings for lower back pain, very important.
If you're stretching your fascia, though, and you say you have to do it for 30 minutes, who has the time? Who has 30 minutes to stretch fascia?
Well, that's why Rob and I we try to encourage stretches while people are at work, specifically while they're using computers. Yeah, and so we try to give them really functional stretches. And one of the little tricks we do like to use, in addition to the hamstring stretch. So I do a modified hamstring pigeon pose. I'll show you in 2 seconds. But tightening the abdomen, getting some length, and breathing while you're doing this. It's not the fascia. It's part of the parasympathetic. You know, calming the parasympathetic nervous system down too, calming the pain system down. It's just a really kind of complex thing. You know, when you start talking about.
Somebody told me that you ought to kind of walk around most of the day acting like somebody's going to hit you in the stomach.
Oh,
because you're tightening up those abs and your posterior chain as well.
I do it all the time, and since she and I have gotten really into this fascia thing again, thanks to you. I literally, if I go to pick something up, or if I go to, put my shoes on or my pants, my abdominal wall tightens up, which is wonderful because it's setting my core. The center has to set so that the exterior can move freely, and that's what we're going to kind of talk about today. You have so when we encourage people to do these hamstring stretches again. So let's say we're going to do a hamstring stretch. First, tighten up here. You want this tight because you want the abdominal wall to get tight and the back to relax. So we're going to lean forward, click, 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 talk, 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 do your work. Let this thing just melt. And if you can stand it for 5 minutes, 10 minutes, 30 minutes, let it go. Okay, without pain. Now, when it comes to, but let's say you don't have that much time, and you want to work on the fascia too. While you're in this position and you're tight here, you can start pushing your heel into the stool or trash can or chair, whatever it is, and that's going to start activating those muscles and specifically that fiber, the fascia. A wonderful little exercise. Another one I love to do. They get to see my fancy Grateful Dead socks today. Modified pigeon pose. They can look up pigeon poses online, of course, but this is just sitting, good length, tighten your tummy, and we're just going to pitch forward.
That's a modified pigeon.
Yeah,
midget. I was thinking the pigeon's being on the floor.
Yeah, but we're going to do it at work. So it's like if I've got a patient there and my back's hurting me, I'm like, golly, I'm really listening to you right now. I'm really paying great attention to what you're saying when I'm stretching this back.
That's awesome.
Stretching your piriformis, you can feel it in your hip, you can feel it in your lower back. But it's just a great way to do some really simple stretches while you're doing it. So tummy's tight. And I tell people when we get to the back, I promise we're going to get to the back. I promise we are. We're working on it. The big key is tightening the tummy first. And everything that we do with these exercises, the Tai Chi exercises that he was talking about earlier, if you are having shoulder pain, hip pain, whatever kind of pain, and it's a fascia-related pain or muscle-related pain, start Tai Chi. But when you start those movements, tighten that tummy. So when you start doing, I'm holding this crazy thing so your dog doesn't get it again. When you start doing your rotational stuff, tight tummy here, simple rotation here. And don't do it to fatigue, because we don't want to, practice bad habits. Just do a couple and then relax. Sit back up, tighten up. Again, rotate. And these are just great ways to start moving that fascia that's matted down in your lower back because we sit all day long.
So you're talking about doing some rotational exercises.
Simple.
Just
simple. Yeah, but tighten up first. Slowly. So I've got lower back pain. I wrecked mine 2 weekends ago and doing something stupid in the yard, picking up something heavy. And the way we treated it was just with these simple motions. Tight tummy, simple rotations, and what it does is started taking the tension off of my back and that sciatic nerve.
Interesting.
Yeah, and it's what it. But you've got to set this out in first, nice and slow, nice and slow. If you don't know what to do, make them up. If you think, well, gosh, it would feel nice if my arm did that, tighten up here and do this. I mean, it doesn't matter. You know, if you're moving,
huge range of motion.
It's restoring range of motion. You know, we were born with it, and we lost it. So what we're trying to do is regain some of it. And one of the ways to regain some of it, and I'm going to have you do just a little exercise here in a second, is to first set the core, set the center first, and then start moving, okay? So lower back pain, failed lower back pain, you've got it, right?
Yeah.
This little ball here. So we've talked about strengthening, we've talked about stretching, now we're going to talk about mashing. The acupuncture, massage therapies, cupping therapies, gua sha, Rolfing, all of these techniques, great ways to put pressure on the fascia. Because when you're, let me have your arm here just for a second. So let's say we're rolling this fascia on your arm. We're pushing the fluid out of that fascia, out of the fascia planes. So when we push the fluid out of it, hopefully it goes back in the lymphatic system, blood system. Then the body makes more fluid. Hopefully healthy fluid. Lubrication, yep.
Yeah.
So we talked about last time the word I couldn't say, hyaluronic acid.
Yeah, hyaluronic
That's
acid.
pretty close, isn't it?
That's the stuff people inject into their faces
Yep.
and take orally. And
Right, and I've been taking mine orally, and I really do think it helps. Yeah. But that in addition to these movement things. So really the key is if you have any kind of fascial problem, I don't care if it's shoulder, hip, knee, ankle, whatever, start here. Set the tummy first.
it's really interesting because Ben and I had taken a course with this guy who teach what's called functional patterns.
Okay.
And you'll have to look at it because for the first month, all you're doing for an hour is taking a roller ball or something very hard and just sitting it on that. It's painful.
It hurts, yes, sir.
But I think that's the whole
Part
point of that thing.
It's
rough.
It's to push that fluid. What you're
rough.
doing, you're trying to push that old fluid out. You're trying to get those fascial planes to start sliding so that because you know as well as I do that your body makes tons of fluid all day long from mucosal fluids to gastric juices, everything. So when you're mashing this fluid out of this old muscle here, what you're attempting to do is to recreate some fresh fascia. Fluid in the fascia.
Kind of like lymphatic massage or even
Same
a
thing.
deep tissue
Same
massage.
thing. Think about lymphatics. Lymphatics, all fascia. The difference is when you do the lymphatic massage, you do it a little bit lighter because it's such a soft type of fascia.
Yeah.
If you hit it too hard, you mash the lymphatic system. It doesn't work. Conversely, your lower back is not lymphatic. It's not soft. It's hard.
Yeah.
So laying back on this, you're going to be like, oh, golly, that's sore. It's supposed to be. You got to start putting some oomph into that to start moving that fascia.
So interesting.
It's crazy, isn't it? I mean, we never weren't taught that, 30
I
years
have
ago.
a lot of tools in my gym, including, of course, the rollers.
Rollers are great.
that are hard. Is that what the
Same
purpose
thing.
of that is?
Same thing. Yeah. You'll see people use the foam rollers for the IT band tendonitis.
Yeah.
It works extremely well to stimulate that fascia, but that's not the only thing that's going to fix the fascia. You need to do these pigeon poses and then stretch that fascia out.
You think you do that before you get into the more aggressive foam rollers or medicine ball type things?
Oh, let's see what the boss says. Stretch first or foam roller first?
I think it's.
Oh, here we go.
The whole thing. I think you have to strengthen core.
Right.
Because that almost intuitively lets
The peripheral.
distal parts relax.
Yeah.
It's almost like the contract relaxer,
Yeah.
antagonist kind of thing.
Yeah. So let's talk real quick. IT band on the foam rollers. What she's saying is,
Yeah.
when you do these foam rollers and you see people laying on these foam rollers, if they're not tightening their core, then the actual musculature on the legs is not going to relax at all. So you need to tighten here. Allow this to relax some. I would probably do this first and try to mush some of it out, and then go into a really nice, gentle. And my favorite kind of yoga is Yin yoga, Y-I-N. You get into and I even hate to use the pose word, but it's like a pose. It's just a position that you can get into comfortably where you can kind of almost fall asleep in. Allow those muscles to release and let go. And you can feel it. If you get in the right hamstring stretch, and as you're working here, and you start to lean forward, you can feel those muscles.
You can feel
As
when
you
it releases
breathe,
too.
yeah. When you breathe.
Breathing has a lot to do with it too, doesn't it?
You stimulate, and that would probably be another great topic. Would be the newest research on the parasympathetic nervous system and stimulating the vagus nerve specifically. And how does the parasympathetic nervous system work with the fascia? Well, it calms everything down, calms your heart rate down.
Yeah.
You know, it allows blood to flow to the extremities. You know, it's a really interesting.
We talk about the vagal nerve a lot. I have a vagal nerve stimulator that you put on your neck,
Yes.
and it's really pretty relaxing.
Yes, we need to talk about that. I'm interested. I saw one, but I didn't know how it works.
Got one right over here. I'll show you
We'll
when
try
we
that,
finish
yeah.
this. But
I do all of these things. It's so vital to work the entire thing because if somebody comes in with a hip pain, it's never just hip pain. Somebody comes in with lower back pain, it's never just lower back. But yeah, this is a massage peanut ball. Now, and what I encourage people to do is buy one. They're $12. They're not very expensive. Put this down on the ground. Put this behind you and move it until if you would be so kind, just lean back to find that sore spot. And let's just say you've got a sore spot right between your shoulder blades, and that's a trigger point.
Yeah.
We talked about that before. What is a trigger point? It's a bundle of fascia. It's a bundle of muscle that's knotted up because the fascia is not moving. So you find that trigger spot there, and then what you would do is you would just
lean into it.
Yeah. And then what you're going to do, tighten your tummy, tighten your core.
That's the thing I never remember.
That's the most important part. You have to do this first. And once you tighten your tummy, then you're just going to go through a real slow range of motion, just moving anything, doing anything. And you can feel as you start to do that, what that does is it mushes that fascia using that massage ball.
I even have these hooks that have a ball on the end of it so you can reach your scapula.
Yep.
I have 3 of those that I use if I get, how you do a lot of pull-ups, you get a sore spot there on maybe your levator scapula.
Yep.
And you just mash it till it hurts like a mother.
Yep.
But then it'll finally release.
Yep.
That's what you do on the fascia.
That's what you're doing. That's exactly what you're doing. Yeah, you do this stuff instinctively. We good?
Oh, here's a vagal nerve stimulator.
Oh, yeah.
It hooks in your phone. Turn it on, put a little ultrasound gel, and then you activate. You can't hear me. Then you activate. You can feel it.
Yeah, cool.
Actually, if you've got it on the vagal nerve, your ear will start pulling down and your lip will start pulling down. But it's a pretty cool little tool.
How funny. Yeah, how funny. And I think that's a great way to help people just reset. Because a lot of times it really is, it's when you have a pain syndrome, finding a way to work with that pain syndrome is the key.
My back already feels better.
It's coming out. And then we're going to get you doing those stretches.
Yeah, I need to really do those slow stretches. I never thought about it when you're sitting there talking to people and
just act like
on yourself.
Dr. Rogers is the best listener we've ever seen. He really leans in and pays attention. Yeah, right. If they only knew the secrets.
If they only
Dr.
knew
Rogers.
I was working out while I'm talking to
You're
them.
exercising and stretching your fascia. That's right.
But actually, you can tell the patient do the same thing.
Oh, I do. We do it. We do it all day long. Just because people they'll tell you, heck, we've got kids, we've got jobs, we got lives, we don't have time. I'm like, well, you have a job. You're sitting. Yeah, the computer. How am I supposed to? This is how you do it. And then,
sitting's the new smoking. Is that what they say?
The sitting is worse than smoking. I don't know. I never smoked, but I'm pretty sure the people that we have that smoked a lot, it's not a really healthy lifestyle.
Yeah, not at all.
Yeah.
Not
And
at
I'm
all.
pretty sure sitting is not too far behind.
And most people are doing it. And they're working on computers. It's worse than ever.
It's worse than ever. Yeah.
I mean, when we were kids, we didn't have that stuff at all.
No. So
We
you got to
never
get
sat
moving.
at a desk.
Got to get moving. So even if it's sore, tighten that tummy. Try walking. Work on those hamstrings. We'll have to have maybe part 2 of hamstrings and knees and.
I should really. Well, we'll get in the gym on the floor and do a few things next time. So, takeaway points to me is tighten your tummy.
Number 1, tighten tummy before you do anything.
And then do the slow stretches.
Yeah. Well, and if,
Stretching the muscle is different than stretching your fascia. It takes
sir.
longer.
Yep.
And you're probably going to need some kind of assistance.
I would
Like
even
one of those or
yeah,
something.
one of those. Yeah, they're wonderful. But if you have no assistance at all, there's no reason why when you're sitting watching TV that you can't prop one leg up on the couch, tighten that tummy, get some length, and start getting some length in that hamstring. You want your knees to be as straight as they can be, because the straighter your knee is, the better vertical load you have. A bent knee is just a bent knee here is going to be a bent spine here ultimately. So all of these things, there's that beautiful kinetic chain that just has to keep moving.
And try to stay upright. I think posture and sleeping position are so important.
Yeah, the posture thing is huge. If you can get people off, and we had a sweet lady today that's on a walker, and I'm like, you've got to get off that walker. Get you a walking stick.
Yeah.
Not a walking cane, but a walking stick. Let's get this head back where it's supposed to be, which is over your heels, safely.
Most people don't fall backwards, do they? They fall forwards.
Not usually, yeah. Not usually. Because, heck, everybody's always leaning forward. They trip, We don't want that.
Yeah.
We want you to have good balance, good posture. Shorter steps. We call it Qigong walking. Qigong walks, short steps. Get your head over your heels and just walk slowly and breathe. Tighten the tummy.
Why do people get shorter as they age?
Oh, gosh. Well,
Because they get pulled over? I know their vertebrae, they kind of...
I think it's more the disc. The disc probably compress more than the
From
vertebra.
lack of hydration.
Yeah, lack of hydration, yeah. And the other thing, honestly, is gravity. I mean, you can see them. It just gets worse and worse.
And that's something you don't want to happen to you.
You don't want that, because that's hard to fix.
Every once in a while, you'll see a really elegant old person in their 90s that stands up straight and, their head's forward like that, and you're just amazed.
Yep.
And I saw one the other day, 103 years old.
Ooh.
She was an elegant lady.
Holy
and
cow.
just stood straight up, was very conversant. And we asked her, how do you look so good, and you stand up? So she says, because I walked every day.
Yeah, that's key. If you can walk, if there's nothing else you do, walking, but stretching those hamstrings, because those hamstrings are going to help stretch your back. Get those knees long. Allow your body to move through a normal plane. Put some air back in those flat tires.
I love it. I love what you say about fascia and all the stuff about muscle stretching, fascial stretching and release. It's just perfect.
Mm-hmm.
Well, what we're going to do now is end this podcast. We're going to make some music.
Yes.
To me, music's the key to everything.
It is.
Right?
It's very healing, very therapeutic.
Don't you love music?
I do love it.
You like to play music?
I love to play.
Next time we're going to play some guitar. We're going to go
Little
out.
mandolin.
Yeah, mandolin. He
mandolin.
plays everything. I just play guitar. I don't sing.
I sing. I sing okay.
One thing
just
I've
very
learned about
poorly.
guitar playing is that if you can sing, you can be a very mediocre guitar player.
Yep.
If you can't sing, you've got to be a great guitar player. Otherwise, nobody would want to listen to you. But anyway,
Wise words
it
from
has
Dr.
nothing
Rogers.
to do with
That's
this
right.
podcast, but music's great.
Yeah.
So Scott Fitzpatrick, master acupuncturist, and Robin, master physical therapist, and thank you so much for coming today. And folks, if you're hurting and you don't see these guys, you're nuts, because they can really help you. I've seen you work wonders, from migraine headaches to there's some cool stuff you can do.
Yeah,
every doctor in town sends you guys patients.
They do every specialty.
It's really, really important, and a lot of people don't even know much about it. So we'll talk more about this in the future. Thank you so much for coming. Robin, thank you for being in the background at least. She's telling us what to do.
She's the best.
So thank you. We'll see you guys next week.
Thank you.